My name is Karolien. I'm a clinical research fellow with the OPDC, and I'm going to introduce to you a study that looks at targeting neuroinflammation in prodromal Parkinson's disease. So we are going to cover the concepts of neuroinflammation, prodromal Parkinson's disease, and then delve into the details of the study. So first up, what do we know about cell death in Parkinson's disease? And this is mostly based on post-mortem and animal studies, and we've identified three key intracellular mechanisms. The one being mitochondrial dysfunction, increased reactive oxidative stress, and then resulting neuroinflammation. And this leads to accumulation of a toxic misfolded protein called alpha-synuclein, which ultimately leads to cell death. So if we zoom in on neuroinflammation as a mechanism, this was initially described in 1988 when it was found that there's activated immune cells in a post-mortem brain of someone with Parkinson's disease. And since then, we've looked at neuroinflammation from various angles. We can look at it from an imaging perspective, so we can do a PET scan where we inject a radioactive tracer. This binds to activated inflammatory cells in the brain, and when we do a brain scan, it lights up, so we can see the inflammation in the brain. We can also look at it from a biofluids perspective, so we can look at stool, blood, cerebrospinal fluid, and we've already shown that there's inflammatory markers in all these fluids. So now let's look at staging in Parkinson's. So if you look at the graph in the middle, usually when someone presents or are diagnosed with Parkinson's disease, it's with a motor syndrome, so tremor, bradykinesia, falls. But at that time point, when we look back, there was actually accumulation of non-motor features for many years and even decades. These include impaired smell, sleep disorder, cognitive changes, mood changes, constipation, dizziness when standing up. And this entire period we describe as the prodrome of Parkinson's disease. So we are going to focus in this trial on one of the syndromes in the prodrome called isolated REM sleep behavior disorder. For those of you who do not know about this disorder, it's a sleep disorder. It's strongly associated with synuclein disorders, which is the protein that accumulates, including Parkinson's, multiple system atrophy, and Lewy body dementia. It affects about 1% of the background population, and there's a conversion rate of about 6% per year if you have this disorder to a defined synuclein disorder. What is this? So usually people present with dream enacting behaviors. So when they are asleep, during REM sleep, their spinal cord is not switched off, so they can actually act out their dreams. They can punch, kick, scream, jump out of bed, etc. So that's usually when they present to the doctor and we make the diagnosis of REM sleep behavior disorder. So this is the long-awaited drug trial. It's got a very long title. I'll highlight some of the important bits. So it's a phase 2A trial. It's multi-center. It's going to be performed between the University of Oxford and the University of Sydney. It's partially funded by Parkinson's UK. It's a double-blind, randomized, placebo-controlled trial, which is what we want for best evidence. It assesses the effect of an oral drug over 12 weeks, looking at neuroinflammation, and we are measuring that using a PET scan. Okay, so let's start with the drug, because we often get questions about this. This molecule is called PXS4728A. It targets two molecules, AOC3, which is amine oxidase copper-containing 3, and monoamine oxidase inhibitor B. And they are associated with increased reactive oxidative stress and inflammation. PXS4728A inhibits them, so it reduces inflammation in the brain. There's already been non-clinical animal studies that show that it irreversibly inhibits AOC3 and MAOB. There's been clinical studies that's been done in a liver disorder and diabetic retinopathy that showed that the drug is safe and well tolerated at a dosage range of 10 to 20 milligrams. So we are quite confident with the fact that the drug is anti-inflammatory, it's safe, and it's well tolerated. So the primary objectives of this study is you will receive the drug for 12 weeks, and we are going to look at the reversibility of neuroinflammation in that time period using, as a primary objective, TSPO PET, which is the imaging I described earlier. We also want to look at the safety and tolerability in IRBD because this drug was trialed in people with liver disorders and diabetic retinopathy. And then we are going to look at the effect of this anti-inflammatory drug on clinical markers, so UPDRS, cognitive tests, as well as digital markers, the smartphone and activity, so more smartphone tests to be done, and also biological metrics, so blood and cerebrospinal fluid markers of inflammation. So as an overview, we are recruiting people with isolated REM sleep behavior disorder that's been confirmed on a sleep study. You must be 50 to 80 years of age, and you'll be randomized at a ratio of 3:1, so you have a 75% chance of receiving active drug. In total, this study will include 5 clinic visits, 2 visits for PET MRI scan in Cambridge, bloods, digital tests done twice, and 1 or 2 LPs. So that is the schedule of events. So initially there'll be a screening visit where we'll do some safety bloods, clinical test. Afterwards you'll have your PET scan. After the PET scan you'll have your baseline visit if there's inflammation on your PET scan. With the baseline visit you'll also have an LP. Then you'll receive the drug, which you take daily for 12 weeks. And at the end of the 12 weeks, we repeat the PET scan and the bloods and the clinical testing. And then there's a 12-week washout period where we can see, did you go back to baseline? Was there a change and it stayed stable, etc. So in conclusion, this is a world-first trial in a prodrome of Parkinson's called IRBD, and we are really excited to be part of it because it hopefully will give us some valuable insights about the pathophysiology and also the reversibility of it in Parkinson's disease, which will hopefully slow down the progression. Thank you.